Peace, mercy, and blessings of God be upon you. First of all, I want to apologize deeply for not posting videos for quite some time. The truth is, there was a strong reason behind this pause. I was honored to join an amazing team working together on Level 2 of Pharma Academy, the largest and most powerful pharmacy academy in the Middle East. I sincerely pray that this work will benefit every pharmacist and help us serve our people in the best, most professional way. So once again, please excuse me for the delay. But God willing, we are back now. And as before, we will continue with new episodes every week here on Octopus Pharmacist. Now, let's begin today's topic together. In this episode, we will discuss vitamin D. We'll learn, what do the numbers in vitamin D blood tests mean? What medications containing vitamin D are available in the market? How should they be used properly? Is it possible to develop vitamin D toxicity? And what is the difference between therapeutic doses and regular maintenance supplements? These are important questions, and today we will go through them all step by step. So stay with me and let's get started. Peace be upon you. I am Hassan Lotfi, and you are watching the Octopus Pharmacist channel in another Thursday episode. Today, we continue our discussion about osteoporosis and bone health problems. Before we begin, let me explain how this video is organized. If you want a specific topic, you can jump directly to that section from the timeline. But if you want to learn everything about vitamin D, then stay with me from start to finish. Now, let's start with the first main point. 1. What kind of vitamin is vitamin D? Vitamin D is a fat-soluble vitamin. That means it dissolves in fat, not in water. The fat-soluble vitamins are 4 in total, A, D, E, and K. Because vitamin D is stored inside the body's fat tissues, it does not leave the body quickly. This storage is useful, but it also means that if someone takes excessively high doses, the vitamin can build up and cause toxicity. Later in this episode, we'll talk about the symptoms of vitamin D poisoning and how to deal with them. 2. The types of vitamin D. Vitamin D has 5 forms: D1, D2, D3, D4, and D5. For human health, the important ones are D2 and D3. D2, ergocalciferol, usually comes from plant sources like mushrooms and fortified foods. D3, cholecalciferol, comes mainly from animal sources like fatty fish, eggs, and liver. Among the two, D3 is more effective, stronger, and preferred in treatment because it raises vitamin D levels in the blood more efficiently. 3. Sources of vitamin D. Vitamin D can come from 2 main sources. 1. Food, found in fish, meat, milk, eggs, and fortified products. But in reality, food alone usually does not provide enough vitamin D for our daily needs. 2. Sunlight. This is the main and most important source. The body can actually produce vitamin D naturally. Under the skin, cholesterol is converted into vitamin D when exposed to sunlight. The best time for sun exposure is in summer, from 9 to 10:30 in the morning. In winter, from 10 o'clock in the morning until 2:30 in the afternoon. Is vitamin D from food and sun already active? The answer is no. The vitamin D you get from food or that your skin produces under the sun is inactive. To become active, it needs 2 important steps in the body. 1. First, it goes to the liver, which adds 1 hydroxyl group at the 25th position. This forms 25-hydroxycalciferol, also called calcidiol. This is a form usually measured in blood tests to check vitamin D levels. 2. Then it goes to the kidneys, which add another hydroxyl group at the first position. This creates 1,25-dihydroxycalciferol, also called calcitriol. Calcitriol is the fully active form of vitamin D. This is a form that gives the body all the benefits: strong bones, healthy immune system, and many other effects. 5. Important questions people ask about vitamin D. Question 1. Do people with darker or brown skin benefit equally from the sun? The answer is less than lighter skin. Dark skin contains more melanin, which blocks some sun's rays. This reduces vitamin D production. So, people with darker skin should be extra careful to monitor their vitamin D levels and may need supplements. Question 2, which is better, D2 or D3? The clear answer is D3 is better. Some people might say they prefer plant-based vitamin D, which is D2, but in practice, D3 from animal sources works more effectively. However, both D2 and D3 are used in treatment. Question 3. If I take vitamin D capsules, is it already active? The answer again is no. Most supplements contain vitamin D in its inactive form. For it to work, your liver and kidneys must be healthy, so they can convert it step by step into the active compound, calcitriol. This is the beginning of our detailed journey into vitamin D. In the next parts of this episode, we will go deeper into the role of vitamin D in bone health and immunity, the signs and dangers of vitamin D toxicity, the differences between treatment doses and maintenance supplements, and the types of vitamin D medications available in the market. So, stay with me until the end of this episode. Together, we'll build a complete understanding of vitamin D, from sources and metabolism to safe use and treatment. The second topic we have today is a very important one. How do I suspect that the person in front of me has a vitamin D deficiency? Or, in other words, what is the real importance of vitamin D in the body? Some books and scientific references even describe vitamin D not just as a vitamin, but as a hormone because of the way it acts and controls so many functions inside the body. 1. The link between vitamin D and calcium. The first sign that makes me doubt vitamin D deficiency is when I see a patient with calcium problems. As we learned in the previous episode, any disturbance in blood calcium levels immediately activates the parathyroid hormone, which tries to bring calcium back into balance. But this hormone cannot work alone. Its main tool, its real weapon, is vitamin D. Vitamin D plays several essential roles. It increases calcium absorption from the intestines. It reduces calcium loss from the kidneys. It helps deposit calcium into the bones. So, vitamin D is absolutely necessary to regulate calcium both in blood and inside the bones. That's why, in children, a severe deficiency causes rickets, where bones become soft and deformed. In adults, the same problem is called osteomalacia, which leads to weak and painful bones. 2. Patients with kidney problems. The second case where I immediately suspect vitamin D deficiency is in people with kidney disease. Why? Because the kidneys are responsible for converting vitamin D into its active form. Without proper kidney function, this process is weakened and the person develops deficiency even if they take vitamin D from food or supplements. That's why patients with chronic kidney disease always undergo tests to monitor vitamin D levels. 3. Patients with parathyroid disorders. The third group is people with problems in the parathyroid glands. Sometimes these patients have hyperparathyroidism, which means the parathyroid hormone is too high. If the problem comes directly from a gland itself, we call it primary hyperparathyroidism. If the high hormone level is caused by something outside the gland, like low vitamin D or chronic kidney disease, then it is called secondary hyperparathyroidism. So, when I see elevated parathyroid hormone, one of the first things I suspect is vitamin D deficiency. For vitamin D and autoimmune diseases, another very important group is patients with autoimmune diseases, especially multiple sclerosis, MS. Studies show that vitamin D plays a key role in regulating immunity. When vitamin D levels are low, the immune system can become overactive and attack the body itself. That's why testing vitamin D is essential in people with MS. Research has shown that about 96% of patients with MS have vitamin D deficiency. Even more interesting, vitamin D behaves a little like natural cortisone. It reduces inflammation, eases symptoms, and improves the patient's response to treatment. 5. Vitamin D and weight problems. Another sign of vitamin D deficiency is difficulty losing weight. If someone struggles with obesity or repeated failure in weight loss programs, I always check their vitamin D levels. In pregnant women, Deficiency can cause serious problems like preeclampsia, high blood pressure in pregnancy, or excessive weight gain. That's why vitamin D and calcium are essential tests during pregnancy. 6. Vitamin D and mood disorders. Vitamin D deficiency can also affect the brain and mood. It is closely linked to symptoms such as depression, anxiety, chronic stress, and fatigue. Why? Because vitamin D is needed for production of proteins involved in making neurotransmitters, the chemicals that control mood. This explains why people in countries with little sunlight, such as Northern Europe and Canada, often develop winter depression. In many hospitals there, doctors first test vitamin D before prescribing antidepressants. When levels are corrected, many patients feel better without needing psychiatric medication. So, the two most famous symptoms of vitamin D deficiency are 1. Depression, anxiety, and laziness. 2. Bone pain and musculoskeletal problems. 7. Who is most at risk of vitamin D deficiency? From all these points, we can now identify the groups of people most likely to suffer from deficiency. People with poor digestion or who don't eat a balanced diet. People with liver or kidney disease because the vitamin won't be activated properly. People with intestinal problems, such as pancreatic disease or malabsorption syndromes. People who take cholesterol-lowering medications, since vitamin D is produced in the body from cholesterol. All of these groups must be regularly monitored for vitamin D deficiency. So, to summarize this part, if you see someone with calcium problems, kidney disease, parathyroid disorders, autoimmune conditions, weight issues, or mood changes, always suspect vitamin D deficiency. Testing and correcting this vitamin is a simple step that can make a very big difference in health. The third topic with us today is a very important one, the blood test for vitamin D. Now, keep in mind, the result can be written in two different units, nanograms per milliliter, Ing/ml, or nanomoles per liter, mol/L. The good news is conversion is very simple. Every 1 nanogram per milliliter equals 2.5 mol/L. So, whatever unit your lab uses, you can easily switch between them. Let's understand the ranges step by step. If your result is below 30 nanograms per milliliter, this is considered low, a clear deficiency. From 30 to 50, this is borderline, better than deficiency, but still not enough for strong bones and immunity. From 50 to 70, this is good, a healthy and sufficient level. From 70 to 100, this is excellent, the optimal range. But here comes a very important warning. Your level should not exceed 100 nanograms per milliliter. In fact, in some guidelines, anything above 125 nanograms per milliliter may lead to vitamin D toxicity. So, the safest goal for most people is to keep vitamin D levels between 50 and 70 nanograms per milliliter, and at most up to 100 nanograms per milliliter. This way, you get all the benefits without risking overdose. The fourth topic with us today. Okay, I know the blood test, and I know it shows we have a vitamin D deficiency. So the big questions are, how do we treat it? What are the sources of vitamin D? What concentrations exist in the market? And what medications are used? But first, keep in mind something very important. There's a huge difference between using vitamin D to meet daily needs in healthy people and using vitamin D to treat an actual deficiency or disease. Daily requirement of vitamin D. The daily need is called the RDA, recommended daily allowance. For infants, the requirement is about 400 international units per day. For children and adults from 1 year up to 70 years, the daily requirement is 600 IU per day. For adults over 70 years, the need rises to about 800 to 1,000 IU per day. Now, how do we take this in practice? For babies, vitamin D usually comes in drops. Each drop contains about 100 IU. So to reach the daily dose, we give about 4 drops per day. For adults, you'll find many products in the market, like capsules containing 1,000 IU. In that case, you simply take one capsule daily. Remember, all of this is for people whose vitamin D level is normal and who are just meeting daily requirements. Treating vitamin D deficiency. Now, if blood tests show vitamin D deficiency, the plan changes. Here's what we do. 1. We start with high therapeutic doses of vitamin D for about 2 months. 2. After 2 months, we repeat the test. If the level is back to normal, we switch to a maintenance dose. If the level is still low, we repeat the high-dose treatment for another 2 months. Once vitamin D is corrected, the patient doesn't need testing every 2 or 3 months. It's usually enough to check once every year or 2. Why? Because people who once had vitamin D deficiency are more likely to get it again, so monitoring regularly is very important. Forms of vitamin D in the market. Vitamin D comes mainly in 2 forms. Vitamin D2, ergocalciferol, plant source. Vitamin D3, cholecalciferol, animal source, and is considered the most effective. In deficiency cases, we usually prefer vitamin D3. Typical therapeutic doses. For vitamin D3, the common treatment options are 50,000 IU once a week for 2 months, or 200,000 IU once a month for 2 months. This can be given by mouth or sometimes by injection. For vitamin D2, in many countries it is marketed as sterogyl. Sterogyl A is taken by mouth. Sterogyl H is given by injection. The dose is usually 600,000 IU once a year. Maintenance, preventive doses. Once the blood level is corrected, we move to maintenance doses to prevent the deficiency from coming back. There are several safe options, for example, 1,000 IU daily, or 5,000 IU weekly, or 10,000 IU weekly, or 50,000 IU monthly, or 200,000 IU every 3 to 6 months, or even 600,000 IU once yearly, either by mouth or by injection. The exact choice depends on the patient's condition, the doctor's decision, and convenience. Best time to take vitamin D. The best time is in the morning, and it should ideally be taken with food because fat in the meal helps absorption. Special disease cases. Everything I mentioned so far is for normal deficiency treatment, but in some diseases, vitamin D is used in much higher doses, along with other supplements. For example, in hypoparathyroidism, patients may need 200,000 IU daily, plus calcium. In vitamin D-resistant rickets, the dose may reach 500,000 IU daily, also with calcium. In familial hypophosphatemia, treatment may require 60,000 IU daily, along with phosphorus supplements. These are rare but very important conditions, and as pharmacists, we must be familiar with them, because when we see these prescriptions, we should clearly understand why the doctor ordered such unusual doses. And that covers the full picture of vitamin D, daily needs, deficiency treatment, market forms, maintenance therapy, best timing, and special disease cases. The last topic with us today, we're going to talk about special forms of vitamin D. Some are partially active, and some are fully active. 1. Partially active vitamin D, alpha-calcidol. One well-known example is alpha-calcidol. This is also called 1-hydroxycholecalciferol. It only needs one step in the kidney to become active. Keep in mind, alpha-calcidol is about 3 to 5 times stronger than normal vitamin D. When do we use it? Mainly in kidney problems, after kidney transplantation, or whenever the kidney is unable to activate vitamin D properly. But there's something important here. Because it is so strong, we only use it for short periods, and the doctor must carefully monitor blood tests to avoid toxicity. 2. Fully active vitamin D, calcitriol. The second important drug is calcitriol. This is the fully active form of vitamin D. As soon as you take it, it works directly. It does not need activation in the liver or the kidneys. When do we use it? In diseases affecting the kidney or the liver, or in cases where we need a very fast result. In later episodes, We will discuss the exact doses and laboratory follow-up in more detail. 3. Vitamin D toxicity. Now, let's move to a very important topic. What are the symptoms of vitamin D poisoning, and how do we deal with them? Vitamin D is fat-soluble. That means it can build up in the body if taken in large or repeated doses. The normal safe upper level in the blood is about 100 nanograms per milliliter. Toxicity usually happens above 125 nanograms per milliliter. What can happen if levels go too high? Kidney failure, high calcium in the blood, kidney stones, or even calcification of blood vessels. This is why vitamin D toxicity is not a joke. We must pay attention to it. For symptoms of vitamin D poisoning, most symptoms are related to too much calcium in the body. Look for loss of appetite, persistent nausea or vomiting, excessive thirst, constant tiredness and weakness, difficulty sleeping, anxiety, and muscle pain. As pharmacists, we often see this in elderly patients. For example, someone takes 50,000 IU weekly, but continues it for months without medical advice. Then they come back with one or more of these symptoms. That's when we must suspect vitamin D toxicity, warn the patient, and recommend testing. 5. Management of vitamin D toxicity. If blood tests confirm vitamin D is above 125 nanograms per milliliter, the doctor usually follows 4 key steps. 1. Stop vitamin D completely for a long period. 2. Stop all calcium sources, including milk, cheese, yogurt, or supplements. 3. Increase water intake, and sometimes prescribe medicines to help remove excess calcium. 4. Give short-term corticosteroids for about 1 week to 10 days because they help the kidney flush out calcium. After this, the doctor will repeat the blood test. When vitamin D returns to normal, the patient can safely restart a maintenance dose. And with that, we have finished today's episode in the Fishing Thursday series. I hope the information was clear, useful, and new for you. And finally, don't forget, subscribe, and share the video. And support the channel on YouTube, Patreon, or PayPal. Thank you. This was Hussein Lotfi.